Hello, I'm Dr. Mark Hong, and I wanted to introduce you to two therapies for one of the most common conditions men face today, BPH. I get a lot of questions about both the Urolift procedure and the green light laser procedure, so I've decided to show you the difference between the two and why one might be right or wrong for you. First, let's talk about what BPH is. BPH stands for benign prostatic hyperplasia and is the medical term for a non-cancerous enlargement of the prostate. BPH is incredibly common, affecting 80% of men by the age of 80. So like death and taxes, BPH seems inevitable for a guy. As you can see here, the prostate sits in front of the bladder, so if you have an enlarged prostate from BPH, it can choke off the urination, similar to squeezing a garden hose. Not all men with large prostates have serious symptoms, and not all men with small prostates are symptom-free. One way to know if you may be suffering from BPH is to have a slow urinary stream or have difficulty starting and stopping the stream. You may be urinating more often than you would like, or going often at night. Sometimes you may feel like you're not totally emptying your bladder after urination. These symptoms can come and go, and these changes can happen so slowly over time that you may not realize you have a problem until it is too late. Some of the therapies we often discuss in the office are changes to your diet, supplements, and medications. Unfortunately, these therapies may not be enough to eliminate the problem, and you may have to consider surgery, or of course just live with it. Now, living with it is okay, and that's what a lot of guys choose to do, but you can run the risk of further damage to your urinary system over time without realizing it. It gets very confusing out there when you start examining the surgical options for BPH. They are quite different in terms of how invasive they are and how well they work over time. Let's look at the options. Tuna and microwave procedures were developed to provide a minimally invasive way to treat BPH in the office. They use minimal sedation and have minimal side effects. Unfortunately, they often have minimal positive effects, with up to 84% of men needing another treatment within 5 years. You can make your own decision, but I stopped offering these procedures a long time ago because I realized men just weren't getting better with these procedures. TURP, or transurethral resection of the prostate, is considered the gold standard of surgery. Nowadays, there are some variations of the standard TURP, including the plasma TURP, saline TURP, and the button, among other names. Basically, this is a roto-rooter of the prostate, taking an electrical knife and scraping out the inside of the prostate. It's one of the most effective surgeries we offer for BPH. Unfortunately, it can have significant risks of bleeding with a long recovery time and time with a catheter in your bladder to drain urine after the surgery. It usually has to be done in a hospital or surgery center and sometimes requires an overnight hospital admission. There's a risk of incontinence or leakiness of urine and scar tissue formation in the prostate after the operation. It also has high rates of retrograde ejaculation, where your semen goes into your bladder after orgasm. While that's not harmful to you, it bothers some men. The green light laser surgery, or photovaporization of the prostate, abbreviated PVP, was specifically developed with bleeding risk in mind. The green light laser works like TURP surgery, but instead of scraping out the prostate, the green light laser melts a channel open inside the prostate. The surgery takes 30 minutes to 1 hour, and I usually perform them in the comfort of my office with a sedative similar to colonoscopy, not general anesthesia. The PVP keeps the prostate open for many years, and you may never need another procedure again for BPH. The PVP is less invasive than TURP with less bleeding and faster recovery. Most men only have the catheter in their bladder for one night. PVP does not affect your penile erections, although over 50% of men will get retrograde ejaculation. You still have a small risk of incontinence and scar tissue formation in the future, but the recovery after surgery is quicker than that with TURP. The first week after PVP is usually the worst, with increased irritation and urge to urinate. On the left, you see the inside view of a blocked prostate. The green light laser works by vaporizing or melting the prostate on the inside, resulting in a wide open channel as you see on the right. Here's a picture taken from the operating room on fluid irrigant used during a green light on the left and a TURP on the right. This isn't to say all TURPs are this bloody, and certainly green light surgeries can also produce bleeding. But in general, there's a dramatic improvement in bleeding from a green light versus TURP, which has been shown in multiple studies. When you've got BPH, essentially you've got a plumbing problem. Now I've had a lot of guys ask me, why can't you just put a tube inside the prostate to prop it open and keep it open? Great idea, and guess what? It's already been tried before. It's called the urethral stent. The urethral stent was an early attempt to do to the prostate what we do to heart blood vessels all the time. Prop it open with a metal stent. The problem is, the prostate continues to grow around the stent and eventually causes a new blockage, at which point you've got a stent completely stuck in the prostate that you've now got to dig out. Great idea, big problem. Which takes us to a relatively new procedure called the Urolift. The Urolift uses the same idea as the urethral stent, but improves it dramatically. Also called the prostatic urethral lift procedure, Urolift involves a small implant placed into the prostate that pinches the inside of the prostate and opens up a channel, kind of like opening the curtains over a window. The procedure is truly minimally invasive, and I perform most of them in my office. It can be done under just local anesthesia, though I always give you the option of being under sedation as well. The Urolift procedure literally takes 5 minutes, and there is virtually no downtime. You don't go home with a catheter, and most guys have 1 to 2 days of urinary irritation afterwards. There's a very low risk of all the bad things we talked about with TURP or even green light, such as incontinence, scar tissue, and sexual dysfunction. Almost all men preserve their ejaculations after the Urolift, which is extremely important to some guys. Here's a picture of what the Urolift implant looks like. For all you engineers and gadget geeks out there, if you must know, the implant is made of stainless steel on the prostate side attached to a nitinol anchor on the outside of the prostate and measures 8 millimeters, or about 1/3 of an inch. Notice that the two pieces are joined by a suture, which means that if necessary, we can remove the implant without harm or damage done. This is how the Urolift works. Without any incisions made, we use a camera to guide ourselves inside the prostate and deliver these implants, which then tent your prostate open. How many implants I place depends on the size and shape of your prostate, and it's difficult for me to know exactly how many you need before we place them. It's rare I need to place more than 4 implants in one procedure. Sounds too good to be true, right? Now the bad stuff. In general, your results are not going to be as dramatic as with green light or TURP. If you're looking to pee like you're 16 years old again, Urolift may not be right for you. Some men get those kinds of results, but we can't guarantee that. Also, we don't have data that proves long-term results, as in over 10 years. However, we know that worldwide, Urolift has been successful for many years at relieving men's symptoms safely and effectively. Now, let's watch some videos to see how Urolift and green light compare. Let's start with green light. Here we have one of my patients who had severe symptoms from his prostate blocking his urination. As you can see here, there's a small ball of prostate growing in the middle of the screen that pushes up into the bladder. This is a special situation called a median lobe of the prostate, and this can cause a worsening of symptoms. You'll also notice the bladder having prominent folds, which are actually muscle fibers. While you might think that this means your bladder is strong, it actually means that the bladder is overworked and in danger of failing. Big biceps, good. Big bladder muscles, bad. We introduce the laser fiber and start vaporizing the median lobe. As you can see, the laser melts the prostate away. As we move on to the side walls of the prostate, you'll see the laser cleanly and efficiently melt the prostate from the inside out. What you'll also notice is that you can actually see what we're doing. If we had bleeding going on, even just a little bit, it clouds the vision and makes this procedure very difficult. That's why it's crucial for us to have a technology such as the green light that doesn't cause too much bleeding. It shortens the time you're under anesthesia and maximizes the time we have to get your prostate wide open. You can start to see a nice open channel forming inside the prostate, which was previously quite blocked. We'll keep at it until the prostate channel is wide open and completely hollowed out, as you see here in the picture. Now, let's watch a Urolift procedure. This is one of my patients who had moderate to severe blockage symptoms from BPH, but as you can see here, does not have a median lobe or ball of prostate growing up into the bladder. If you do have a median lobe, you're not a good candidate for the Urolift procedure. Also, his bladder is a bit healthier than the last gentleman, which tells me we're getting to this man before the damage to the bladder has been done. Here, you see the Urolift delivery device inserted into the prostate channel. The device contains that small implant we saw earlier. I picked the right spot to maximize the tenting effect and deliver the implant. I do the same thing on the other side. Now, we pull back from the bladder into the prostate channel and see a significant opening of the prostate from the delivery of just 2 implants. You'll also notice there's no bleeding to cloud our vision. Let's see that again. Here's the prostate blocking the urinary path before Urolift. Here's the prostate channel wide open after Urolift. Take my word, these images are not photoshopped. Now, let's see a blocked prostate, an open prostate after green light, and an open prostate after Urolift. It's a bit unfair to compare these pictures side by side because they're not from the same patient, but you get the idea. I can get your prostate completely open with a green light procedure, and if you want the maximum possible result, then go with a green light. However, if you want something minimally invasive that also opens up the prostate significantly, then go with Urolift. Of course, if you get a Urolift and are not satisfied with your results, you can always then get a green light or TURP done. To summarize, there's no such thing as a right or wrong answer when it comes to choosing Urolift or green light. Every man is unique, with different prostate size, shape, and desire to get maximum results versus minimal side effects. Not every nail needs a sledgehammer, and much of my job is to help you understand what tool is right for your situation. An individual approach is what you will get when you come in to see me for your urinary symptoms. Maybe you don't need anything at all. Maybe we need to get you on a prostate healthy diet. The answer depends on you and your situation. Before you go, just a few things about me. I am proud to have trained at some of the world's finest institutions, but I'm also proud to have delivered innovative care in the Phoenix community for many years. I strive to treat everyone with respect, integrity, and compassion. And by the way, I'm not a consultant to any of these BPH companies I've talked about today. Please visit me on my website, markhongmd.com, to learn more about BPH, these therapies, and how to get in touch with me. Thanks for visiting.